Today, I'm delighted to introduce our presenter, Dr. Tabashir Nobari, Assistant Professor in the Department of Public Health. Her research focuses on early childhood obesity, adverse childhood experiences, including food insecurity, housing insecurity, and homelessness, and neighborhood quality. For 10 years now, Dr. Nobari has studied these issues among children who participate in the Special Supplemental Nutrition Program for Women, Infants, and Children, otherwise known as WIC. WIC is the Federal Nutrition Assistance Program for low-income mothers and children. Dr. Nobari did her pre- and postdoc work with WIC in Los Angeles County, the nation's largest local WIC agency. At the UC San Francisco Center for Health Equity, she worked on the Robert Wood Johnson Foundation Commission to Build a Healthier America that examined the many factors outside of medical care that influence health. In addition to her US work, Dr. Nobari has taught and conducted research internationally in Senegal, Western China, and Tunisia. She is passionate about preventing social, economic, and racial health inequities among young children and college students. With that, let me turn it over to Dr. Nobari.
Thank you very much, Lisa, for that introduction. And thank you to all of you for being here, and to Dean Rhodes and the College of Health and Human Development for the opportunity to talk to you about these issues. I'll be discussing findings from a few of my studies. And so before I begin, I'd like to acknowledge my collaborators on this work. So PHFE WIC, UCLA, and the funding that I've received from these organizations.
We're good?
Okay, now we're good. So first I'll provide some background on housing cost burden, homelessness, and food insecurity. The first half of my talk, I'll be talking about young children. And the second half, I'll be talking about college students. So I'll be talking about these issues, excuse me, in conjunction with these two groups. I'll then discuss the prevalence of housing insecurity and homelessness among young low-income children in Los Angeles County, and how this can influence both their home environment and their health. I'll talk about low-income families' experience with housing, and the studies that I'll be talking about occurred before the pandemic. And so this really provides us a baseline from which we can later then see the impact of the pandemic on young children's and low-income families' experience with housing insecurity and homelessness. The second half of my talk, I'll be discussing the impact of the pandemic on Cal State Fullerton students' basic needs and their access to resources. I'm planning on spending about 35-40 minutes discussing these issues, and then the rest of the time I'd love for us to, I'll be answering questions, and I'd love to hear from you as well about your experience with students, and some of you are work in the community as well, and I'd love to hear about what you're seeing. You've all seen the headlines that the lack of affordable housing is a crisis in this country and affects both rural areas and urban areas. In 2017, 38 million households in this country were housing cost burden. And this means that they were spending more than 30% of their gross income on housing related costs, their mortgage payments, their rent, their utilities. Also, 11 million of renter households were severely housing cost burdened. So this means they were spending more than half of their gross income on these housing related costs. And we see here that while every state in the nation experiences a shortage in affordable housing for extremely low income renter households, the West Coast has some of the greatest shortages. So California here, there are only 23 homes that are affordable and available for 100 extremely low-income renter households. And by extremely low income, I mean households that are less than 30% of the area median income or living below the poverty level. And to give you a sense of what that is, in 2020, a family of four would be making less than $26,000. Long Beach, Anaheim, Los Angeles area, the shortage is even more acute, so there are only 20 units per 100 extremely low-income families. And so for families who are poor or low income, a negative event such as losing their job, getting a divorce, or even a mundane event like having auto repairs can push these families into homelessness. So this affordable housing crisis was one of the main reasons why we see such high rates of homelessness in California. And so for 3 nights in late January of every year, nationwide, a point-in-time count is done of both the sheltered and the unsheltered homeless population. And by homeless, I mean anyone who doesn't have a fixed, regular, and adequate nighttime residence. And you see here that while homelessness is a nationwide crisis, in California, nearly 130,000 individuals were homeless on any one night. In Los Angeles County, close to 59,000 individuals were homeless, and that includes nearly 9,000 families with children. Orange County, there were close to 7,000 individuals were homeless, and that includes the nearly 1,000 children who were homeless as well. And I present this information to highlight the extent of the problem in California, Los Angeles, and Orange County, but also to really emphasize the fact that homelessness affects all states. And I'll be talking about this more later in the presentation, but we need to be careful when using the term homeless when we're talking about children. So under the McKinney-Vento Act, which the Department of Education uses, it includes families who are at risk for homelessness in their definition. So this means families who are living with other people because they can't afford their own place. So they're doubled up. So using this definition in California in the 2017-2018 academic year, we saw more than 250,000 of children in public school were homeless. In Los Angeles County, 4% of students were homeless. And most of these you see from the pie chart are sheltered. They're doubled up, they're living in hotels or motels. But even though they are sheltered, they're still experiencing a lot of housing instability and insecurity. And when we think of Los Angeles and Orange County, we often think of these huge mansions in Beverly Hills. We think of sun, of palm trees, these wide streets where children can ride their bike, swimming pools where they can go swimming. However, contrasting this is the reality of families who are struggling to pay rent. So they're living in unsafe and poor neighborhoods. They might be couch surfing. They might be living in a garage like Angelina, who's pictured on the left. They might be living in a motel like the family pictured on the right. And these pictures are from a series that Steve Lopez did for the LA Times back in 2018. And it really highlights the challenges that these families face to obtain shelter and how temporary and unstable their situation is. And being homeless or housing insecure can have profound effects on children's health, their development, and also their academic performance. Difficulty paying for housing and food insecurity are strongly correlated. So people who are struggling to pay their rent or their mortgage, they're more likely to be housing insecure, food insecure, because they're prioritizing their housing first. So we saw that in 2019, nearly 11% of households in this country were food insecure. And that includes 2 levels. That includes being low food insecure and very low food secure. And so 8.3 million households in this country were low food secure. And that means that because of financial reasons, they were eating less varied and poor quality diets. So maybe they weren't eating all the different fruits and vegetables they wanted to. Maybe they were opting more for the cheaper processed foods, but their dietary patterns weren't disrupted. They were still able to have breakfast, lunch, and dinner. Their food intake was not affected. Now, 5.3 million households in this country were very low food secure. And that means that at least one member in the household was skipping meals, cutting the size of the meals, or going without. They might have been losing weight as well, just because they didn't have enough money to buy food. In this country, 13.6% of households with children are food insecure. Now, generally, children are protected. So normally, the parents go without food first so that the children can eat what they need to. However, children in more than 200,000 households in this country had disrupted eating patterns and reduced intake of food. And so food insecurity is linked with poor nutrient intake. Food insecurity is also a stressor, and so it can impact children's development. It can have an impact on their behavior, and it can also affect their academic performance. Now, the data I've just presented are what happened in this country before the pandemic happened. And since the start of the pandemic, 57 million people have filed for unemployment in this country. And so because food insecurity and housing insecurity are tightly linked with poverty and unemployment, it's estimated that 17 million more people could become food insecure in this country, including 7 million more children. The Pew Research Center has also done a survey, and they found that 32% of households had a difficult time paying their rent or their mortgage. The Census Bureau conducts a household pulse survey, and they've been doing it since the start of the pandemic, and it's really to examine the impact of the pandemic on households' social and economic conditions. And they release data every week. And what they found that despite things having improved since the peak in April, so fewer people are unemployed, but despite that, 16% of renters in this country are still not caught up on their rent. And higher rates are seen among Black, Latino, low-income households, and households with children. Now, given the high cost of attending tuition, the additional educational expenses, the high cost of living as well, many college students are also struggling with homelessness and food insecurity. And as part of the Cal State University Basic Needs Initiative, Drs. Crutchfield and McGuire found that 11% of students were homeless, 42% were food insecure. And recently, an online survey was conducted by Dr. Goldrick Rabb and her colleagues at the Hope Center, and they found that among students at 15 four-year institutions, 15% were homeless, 41% were housing insecure, and 38% were food insecure. And these have been found to have an effect on class attendance, students' GPAs, whether they complete college, in addition to their mental and their physical health as well. I'm now going to discuss some of the studies looking at housing insecurity and homelessness that I've conducted among low-income children here in Los Angeles County. There isn't a universally accepted definition of housing insecurity. So housing insecurity is housing that is unstable and insecure, and it can include severe housing cost burden. It can include missed housing payments, being at risk for being evicted, living in housing that is unsafe and poor quality. And at the extreme, it can also include homelessness. So either being unsheltered, living in a car, or it could also mean doubling up because of financial reasons. So for the next section, I'll be discussing a few different dimensions of housing insecurity and homelessness. And for these studies, I focused on children enrolled in the Special Supplemental Nutrition Program for women, infants, and children. In this program, as Lisa mentioned, it's federally funded, and it's for low income and at nutritional risk, pregnant, postpartum, breastfeeding mothers, infants, and children up to their 5th birthday. And it provides nutrition education, it provides supplemental foods, breastfeeding promotion and support, and then medical and social service referrals as well. And by studying children enrolled in WIC in Los Angeles County, I'm studying a very large percentage of young children in Los Angeles County. In 2019, more than half of infants and children up to the age of 5 in Los Angeles County were enrolled in WIC. And to kind of give you a sense of how many children that is, in 2019, nearly 700,000 children under the age of 6 lived in LA County. And these children are primarily Hispanic, so 83% reported being Hispanic, 8% reported being non-Hispanic Black. 31% of children have parents who did not finish high school, and the majority of children live below the federal poverty level, including about 40% who are living in extreme poverty, so less than 50% of the federal poverty level. And to give you a sense about what that number is, 2020, that's $26,000 for a family of 4 for the federal poverty level. So very few data sets have information on children's housing situation, their health, and their WIC status. And so to determine the prevalence of housing insecurity and homelessness among children enrolled in WIC, I used a very unique data set, the Los Angeles County WIC survey. And this is a triennial survey on a random sample of about 5,500 WIC families in Los Angeles County. Computer-assisted phone interviews are conducted in both English and Spanish, and the survey asks questions related to health behaviors, related to breastfeeding practices, the home environment, and healthcare coverage. So I've included the website for you there, lawicdata.org, if you're curious and you want to find out more. They've got a lot of great statistics on their website, as well as trends in a lot of different indicators. So I found that in 2017, a third of children enrolled in WIC in Los Angeles County were housing insecure. And this includes children who were living in households that were severely housing cost burden. For the purposes of this study, and the family reported that they had a very difficult time paying for housing. It also includes children who had moved more than two times in the past 3 years, and it includes children who were doubled up, so they were living with parents or relatives. I also found that 11% of children had a parent who had been homeless or at risk for homelessness. And this means that the parent either moved because they couldn't make their housing payment, they didn't have a regular place to sleep at night, or they were actually homeless. And so the first few years of childhood are critical in terms of children's cognitive, socio-emotional development, and their physical and mental health, not just in childhood, but also throughout their life course. So this unstable housing situation can have a deleterious impact on children. I looked at differences in housing insecurity by race, ethnicity, and child's age, and found that among young children, so less than 2 years old, 41% of non-Hispanic Black children were housing insecure, compared to about 33% among Hispanic children and 37% among non-Hispanic white children. However, these differences weren't statistically significant. I then looked at differences in parents' risk of homelessness by race, ethnicity, and child's age as well. And you see here that among the very young children, so among children less than 2 years old, 14% of non-Hispanic Black children had already had a parent who had been homeless or at risk for homelessness during their lifetime. And this number increases when you're looking at 2 to 5-year-old children. So more than a quarter of Black children had a parent who had been homeless or at risk for homelessness. And so we see these disparities that exist by age and race. And so the natural question is, what is the impact that this can have on these children? So how can housing cost burden and homelessness affect the health of these children? So I looked at the differences in their exposure to adverse experiences and negative life events by severe housing cost burden. And I found that the home environment of children who are living in severely housing cost burden households tends to be more stressful, whether that means that their mother the mother is more likely to have depressive symptoms, or the household is more likely to be food insecure. These children are also more likely to experience negative life events, such as their parents being separated or divorced, or the parent experiencing a loss of job, being homeless, or having their pay cut. Children whose parents had experienced homelessness or had been at risk for homelessness since the child's birth were also significantly more likely to experience these adverse childhood experiences and negative life events. And we do see that the gaps by homelessness are actually much greater than what we saw by housing cost burden. And echoing that much of homelessness is due to insufficient income. More than half of parents who had been homeless had their pay cut or had lost their job. And these adverse experiences and the toxic stress that results from them can threaten a child's safety, security, and well-being, and can have lifelong consequences on these children. I also found that children living in severely housing cost burden households were more likely to be obese than children who weren't living in these households. I then wanted to do a deeper dive and understand really what these families were experiencing. What were some of the life events that led to them being homeless or housing insecure? How were they coping? What were they relying on? And how did this really affect their health? So with my collaborators at PHFE WIC, we did interviews among 30 WIC families, and these were families who had mentioned that they had been housing insecure in the 2017 LA County WIC survey. So we were following up with them. And we spoke with families who were white, Black, Hispanic who spoke Spanish, and Hispanic who spoke English. And we found that often families reported that rising rents were a cause of their homelessness or their housing insecurity. Also, some families had been evicted from the landlords, or underemployment was also listed as a cause. Additionally, life changes, such as having a new baby, could increase their risk of becoming homeless or housing insecure. Most families were living in apartments or in houses, but some did live in a trailer and some did live in a motel. And for those who were homeless, some were living in their car on a continual basis, and some did it only a few times. And when they were living in their car, the children would often stay with relatives, but sometimes the children wanted to be with the mom, and so they were staying with her in the car. For those in a motel, there was that constant stress they mentioned of having to come up with the cost of every night. So sometimes it was $55 they mentioned. So that constant stress and worrying about whether they would be able to come up with that money. One family who had been homeless discussed the process of going from a motel to a shelter, and thankfully, they were eventually able to find an apartment. Families did mention that they were doubling up, generally with older relatives, such as parents or in-laws, so that they could pool their resources together to afford rent. However, family dynamics, issues with parenting and who was doing it the right way, providing care to a sick relative, sometimes providing money to that relative were also cited as being stressors for them. We found that there were some differences by race ethnicity. Black families were more likely to experience homelessness and have fewer resources from which to draw. Families also mentioned that it was very difficult for them to find a place. They cited poor credit as an issue, having kids making things more difficult, having a place that was full of pests or mold or mildew also made things difficult, and race ethnicity as well. So one woman shared with us she was white and she was married to a Black man. And when her husband went to get an application to rent a place, the landlord told him that they had already rented it. But she went the next day and the landlord gave it to her. Family social networks were mentioned as being very important. So some relied on family members for food and lodging. However, not everyone had family who could help. So one mother shared with us that she relied on her church to help pay her bills and also to receive social support from the parenting classes that the church provided. Many of the mothers mentioned experiencing stress, and so they wanted mental health services. However, some had access to them, but when they factored in how much time it was going to take and they needed to get a babysitter for all of that time, they couldn't justify the cost. Participants mentioned that they were reluctant to tell WIC staff that they were homeless or worried about becoming homeless. So even though WIC staff are there to help them and to offer referrals, they weren't doing so because they were afraid of being stigmatized. And more importantly, they were worried that Department of Children and Family Services would take their children. WIC was mentioned as being very helpful to families, and many relied not just on WIC, but also SNAP and food pantries and the National School Lunch Breakfast Program. However, not everyone was aware that they were eligible for these programs. So some key takeaways from these studies were finding high rates of young children who are living in unstable homes, whether we're considering housing cost burden, housing insecurity, or homelessness. And these high rates are alarming, especially given the sheer number of people enrolled in WIC in Los Angeles County. And the affordable housing shortage crisis in the US is likely to have lifelong repercussions that will affect future generations, given that these children are at greater risk for being exposed to adverse childhood experiences, for living in households that were food insecure, and for being obese. And the stark racial ethnic disparities that we found are a consequence of the long-standing institutional and structural racism that Black families in the US face, particularly in housing and labor markets, in the criminal justice, education, and healthcare systems. And so it's really important that we take a racial equity approach in addressing homelessness and housing insecurity among families. Now, I showed you data from before the pandemic. And so it really will act as a baseline for what is happening with the pandemic. And the Los Angeles County 2020 WIC survey is currently being conducted, and they've added a COVID-19 impact supplement to it. So we'll be able to see how the pandemic is affecting these families. Thankfully, as of now, they've had close to 3,000 participants. They're finding that there are similar rates of housing insecurity as in 2017. So it might be that the tenant protections are working, or families are able to cobble support together. However, families did mention, 64% of families mentioned that they had a difficult time paying for housing due to COVID-19. Now I'll be discussing the findings of a study my collaborators and I have done looking at the impact of the pandemic on Cal State Fullerton students' basic needs and their access to resources. And I want to thank my collaborators, Dr. Kolelat, Dr. Pim, and Dr. Sammy for their help. I also want to thank Hannah Peterson, who's an MPH student in the Department of Public Health. And I also would like to thank the support we received from the Division of Academic Affairs, Assessment, and Institutional Effectiveness, specifically Dr. Sue Swarat and Afshin Karimi. So during the summer, from June 30th to July 20th, we surveyed Cal State Fullerton students who had been enrolled in the spring semester. And we invited about 8,203 students to participate in the online survey. And this was a 20% random sample that was representative of the student body, both in terms of race, ethnicity, gender, academic, college, whether they were undergraduates or graduates. We also invited more Black and African American students to participate, since we really wanted to look at these differences by race and ethnicity. 1,398 students completed the survey. So we had a response rate of 17%. Students were given an opportunity to receive one of several $50 Target gift cards. And we weighted the data by students' reported race ethnicity according to the racial ethnic distribution of the student body. So as you see here, most of the sample was between 18 and 24 years. The majority of respondents were female. The race ethnicity of respondents was reflective of the racial ethnic distribution of the university. So 41% were Hispanic, Latinx, 20.7% identified as Asian, 16.9% identified as non-Hispanic white. The majority of students were juniors and seniors. 44% of students were first gen, and about 12% of students were also parents. We also asked about COVID-19, and 8.2% of students said they had been diagnosed with COVID-19 or were living with someone who had been diagnosed with COVID-19 at the time of the survey. So half of students experience a change in employment due to the pandemic. And this includes the 16% of students who reported that they had lost their job because of the pandemic, 36% who had had their pay or their hours cut or they had been furloughed, and the 6% who reported that they had to get an additional job to make ends meet. Like many people, the students reported a loss of income after the pandemic, and 44% reported that they had lost employment income, with most of the students experiencing a loss of $500 or more. So you see that here. Now we asked about food insecurity and homelessness since the pandemic had started in March. And we also asked about it before the pandemic, so 12 months before the pandemic. And we find that before the pandemic, 15.9% of students reported having been food insecure. Since the pandemic, 30.8% were food insecure. So this increase is also statistically significant. And regarding homelessness before the pandemic, 6.7% said that they had experienced at least one instance of homelessness. And since the pandemic, 8.2% said they had experienced an instance of homelessness. However, this number is not statistically different. Now, if you all recall, at the beginning of the pandemic, those first few months, it was often really difficult to buy groceries. And it was difficult. People were fighting over toilet paper, shelves were empty. And so we didn't just ask about food insecurity, which really gets at insufficient income or money to be able to buy groceries. We also asked about other reasons that they might not have been able to access the food that they wanted. And you see here that 55% of students weren't able to get food for one reason or another. So 13% mentioned they couldn't get out to buy food. And this included having difficulties with transportation, having mobility issues, or having health issues. Most of the students mentioned that they were afraid to go buy food or just didn't want to. A quarter of students said that the stores didn't have the food that they wanted. We also asked about different dimensions of housing insecurity that students might have experienced since March. And we found that 49% of students experienced one of these dimensions. And I'd like to draw your attention to these three bars here. So nearly a quarter of students reported having a very difficult time paying for housing. Nearly a quarter were unable to pay last month's payment on time. And this includes students who had to defer payment as well. And a quarter said they weren't confident that they would be able to make next month's rent as well. We also had about 5% of students who had to move because they were unable to pay for their housing, and about 4% who moved in with others for financial reasons. And I'm not showing the data here, but we did ask them, of the students who did not make their last month's payment or weren't confident that they would be able to, we did ask them if they were aware of the housing protections that had been in place. So there were a number of eviction moratoriums that are in place. And 44% of students said they weren't aware of those housing protections. We looked at differences in food insecurity, homelessness, and housing insecurity by race, ethnicity, whether the student was a first generation student or not, and whether the student was a parent as well. So the red bar, there's a lot of bars going on, but the red bar is for all students. And we see that there are differences by race, ethnicity, and whether they're first gen or whether they have children. And it varies by the basic needs insecurity we're looking at. And so you see here with food insecurity, Black African-American students, that's the turquoise bar, they have higher rates of food insecurity. Also first gen students, which is this dark blue bar, and Middle Eastern North African students, which is the yellow bar. For homelessness, Black African-American students were more likely to experience homelessness, as well as students who reported more than one race, so multiple race students. When we're looking at housing insecurity, we see high rates among Middle Eastern North African students, as well as students who are first gen and who have children, so the dark blue and the dark green bar over here. So this is just preliminary data, and we'll be looking at these data in more depth, specifically around the different dimensions of housing insecurity so that we could see if we could get a better understanding of what's happening. Are there certain groups of students who are more likely to experience some of the different dimensions of housing insecurity? We then asked students about the programs, grants, and other forms of assistance they were relying on. And the great news is 2/3 said they were able to get some assistance. This includes the 35% who were relying on 2 or more sources. 18% of students said they were relying on Medi-Cal, Medicaid, 8% were getting CalFresh, 6% were getting the pandemic EBT, and this is a new program. So it was implemented because schools were closed. Students were, young students in K through 12 were no longer able to get the free reduced price school meals. And so pandemic EBT gives the families money so that they can provide for their children. 39% of students were receiving the CARES emergency grant. A lot of students relied on family and friends, both for financial assistance, but also for food or housing assistance. And we see that 10% were relying on a food pantry as well, or a similar place. Now we asked students if they had any trouble enrolling in some programs or getting grants or getting some form of assistance from families and friends. And 22% did report that they were unsuccessful. But when we look at the breakdown, we see that 5% of students only said that they couldn't access CalFresh. 2% couldn't access Medi-Cal. 2% weren't able to get financial assistance from family and friends. 6% weren't able to get the emergency grant. And we have asked students, what are some of the reasons that you weren't able to enroll in these programs or to receive the grants or the help from your friends and family? And so we'll be looking at that data in more depth. Some options that were given were whether they didn't meet the income eligibility or whether they didn't meet immigration status or if it was too difficult to apply. So we'll get a better understanding of some of the reasons for this. Now, we also asked students about what assistance would be most useful to them to cope with their housing and food situation. And major themes were financial assistance. So whether that's in the form of financial aid, tuition reduction, or a second relief check. Some mentioned grocery assistance, so help with CalFresh, access to food pantries. Others mentioned that they wanted mental health services, and still others mentioned that they wanted information of the resources that existed. Students also shared with us that the pandemic was having a toll on their mental and physical health. Some mentioned they were struggling with online classes and it was difficult for them to maintain their GPA. Students also missed the ability to socialize with their friends. Moving back home proved to be a difficult transition for some. For those who were struggling financially, they were very worried about when the next meal would come. And for those who got COVID-19, it made everything worse, whether that was school or struggling to pay bills or rent. So I want to end here with some key takeaways. We found high rates of basic needs insecurity. Food insecurity has doubled since before the pandemic. and some groups are more vulnerable than others. However, the good news is the majority of students are receiving some form of assistance, but more is needed. And I also wanted to remind you of some of the resources that the university offers. So the Division of Student Affairs, Dean of Students, has a COVID-19 resources page, and it provides a listing of all the resources that are available, whether that's how to apply for CalFresh, the rental assistance that's available, and information about off-campus financial resources. There's also Tuffy's Basic Needs Services, which provides food assistance, short-term housing, and emergency grant funds to students. ASI also has a mobile food pantry, and I've put the link there for you. And ASI is providing a no-contact drive-through and walk-up mobile food pantry option. Students do need to register before the event, though. And then finally, this week, it's Hunger and Homelessness Awareness Week, and so Tuffy's has put together a number of wonderful talks and webinars, so I wanted to share that information with you as well if you weren't aware. So I really appreciate you being here and letting me share the results of what we found. I'm hoping you'll also share some of your experiences of what you're seeing with students and the community. So I'd like to thank you very much for your time.
Thank you, Tabashir. Please go ahead and use the chat function at the bottom of your Zoom window to ask any questions if you have any, or if you want to, and I'll read those questions, or if you want to use the raise hand feature, I will unmute you. So we have our first question coming in. Go ahead, Dr. DeStefano.
Hi, I was just congratulating Dr. Nobari on an excellent presentation. I do actually have a question. It's not a big one, so I was going to let other people go first. But Taba, when you talked about doubling up, I think I missed your definition of that. Did you mean like intergenerational people, like younger and middle-aged parents with kids moving in with their parents, like a multi-generational household? Is that what you meant by that, or?
So it could be that, but I meant that they're living with other people for financial reasons. So they could be living with family members or relatives, or they could be living with friends just because they can't afford their own place.
Assuming that they were living like on their own before that?
Yes. Yes.
Okay. I will say that I was so interested in this talk today because I've been doing some research, a lot of it on housing in the San Gabriel Valley specifically, some ethnographic work. And it really resonates a lot of the stuff you found. So just very helpful for me to help understand what I've been seeing in LA County. So thank you.
Thank you, Tony. I'd love to hear more about what you're finding as well. So,
yeah, we'll talk.
Yeah, great.
Okay, we have another question from Dr. McElligott.
Archana, I think you're muted.
Yes, thank you. Thank you so much, Taba. That was fantastic work, results, and just shows the depth of your work with WIC. So that was tremendous. I had a question, I had a couple of questions. I was wondering, now for a period of time, fortunately, we did have a time when we saw a reduction in childhood obesity. And that was really during the Let's Move campaign. We saw a slight reduction for those under 5-year-old. So we were having some success. And so I wonder during that time, was the food insecurity and homelessness, was there a decline in the population during that time with the WIC population? And that's probably a broader question in terms of trends. So do you recall kind of that period of time when we're seeing this reduced rate of childhood obesity?
That's a great question. So I've done some work looking at trends in early childhood obesity, and we're finding that it increased until about 2010, kind of plateaued until about 2014, where it started to decrease. Recent data among very young children, so 2 to 5 year olds, is finding that perhaps it's increasing again. And so we really need to continue monitoring that to see if that's just a blip, 1 or 2 years, or we're really seeing a trend where things aren't looking so good anymore.
Yeah, yeah. It actually goes to show, and it's kind of a broader question, a broader maybe comment, that these policies that are put in place, for example, Let's Move movement, getting more healthful foods in schools. I mean, that was a really big emphasis for 8 years, especially the last, from 2010 to 2016. There was such a huge emphasis on healthful eating. And so maybe that goes to show that potentially there are more strategies that we can utilize to reduce food insecurities and improve homelessness rates. The other question I had is, it would be interesting kind of to see across WIC sites what's going on. Maybe there's other best practices at the site, or it's the partnership with not just the WIC sites, but with the local communities, local governments, is there one site that's doing better in terms of food insecurity?
Definitely. Yeah. So you raise some really important issues, and there's a lot of great work done looking at the neighborhood environment, but also what the different programs that WIC children are exposed to according to where they're living. I know of some researchers at UCLA, Dr. May Wang and Dr. Michael Prelip, and they've looked at programs that WIC children have been exposed to in Los Angeles County since 2005. And they are seeing differences in obesity risk according to the programs that are available and the policies that are available for these children.
Yeah, great. Thank you so much.
Thank you, Archana. We have a couple questions, Tab. Regarding food insecurity among CSUF students before and after COVID, the before prevalence seems low. Any reason for why that might be?
So that's a great question. So it's lower than what the Basic Needs Initiative study found, definitely. And so it could be that students aren't recalling their experiences with food insecurity. We're asking for 12 months from before the pandemic. So that was February 2019 to February 2020. So that is a possibility. There could also be differences in the year. So we're going to look a little bit more at the data, and we might see that freshmen are experiencing less food insecurity during the time before the pandemic. Maybe they were more likely to live with their families. And we might be seeing more food insecurity among the juniors and the seniors since they were living by themselves. So it's definitely an avenue that we want to explore. But I know we have a few people on the call with us now on Zoom. Some are with Tuffy's Basic Needs. And so I'd really love to hear from you if you have any thoughts, as well as why we're seeing rates that are lower than what the Basic Needs Initiative found.
Thank you. We have another question. Did you ask about documented or undocumented students?
No,
my hypothesis, the questioner asks, my hypothesis is that it's worse for those without documentation, particularly in accessing basic needs.
I think I agree with you. That would be my hypothesis as well. And we, as I mentioned, we asked why they weren't able to enroll in some of the programs like CalFresh and Medi-Cal. And one of the options was immigration status. And so when we look at that data, we might have a better understanding of who is undocumented, but we didn't ask specifically. No.
Great. Any other questions? Okay.
I have another question, mainly because it's such a critical topic for Southern California. Actually, for California, I mean, per your map, and as we know, homelessness and food insecurity really is something that many of our citizens struggle with and endure. So I wanted to find out, what do you think about in terms of, and I know this is more of a broader question, but best practices in terms of getting people off of, from being homeless. Some studies actually suggest that, and you actually found this too, that family support is very key. And one of the key indicators to helping individuals get out of homelessness was to have this family support. So how do you think, and also to make a bridge with policy and working with our local officials? It's much of a broader question. What do you think might be things that maybe even Cal State Fullerton? I mean, I think we already do a really good job in working on things, but things that we could actually do.
So Cal State Fullerton is doing a lot of great work. And here again, Toughies, there's emergency housing that's available for students. And I know there's a lot of faculty at Cal State Fullerton who are working with community organizations in Orange County and beyond to kind of help serve the homeless population. But I think for this issue, we do need to kind of think bigger and think about policies around creating more affordable homes for families and providing them with job training so that they're able to access the jobs that pay a little bit more. There was a lot of work that's been done around like Project Room Key around getting homeless during this time, during the pandemic, into shelter, right? And so I think we really need to think about how can we get these families into more affordable housing so that this can be a long-term solution.
Great, thank you. One final question before we're done. We have a couple minutes. Thank you, Tabashir. This has been a really great presentation. A lot of just great data to look at and to just think about, right? Not only what's going on in Los Angeles County, in Southern California in general, but what's happening here with our own students. So thank you so much for presenting. Thank you all for joining our Lunch and Learn today. We look forward to having you join us again. For those of you that are here or know those that couldn't make it or would like others to view this presentation, we'll be letting you know about the recording for this being posted in a few days. So with that, I will say thank you. And thank you again, Tabashir. Have a nice day, everyone.
It was wonderful seeing you.